And we are live. It's Dr. J here in the house. Really excited to be back during the week here. Put your comments down below. Make sure you subscribe. Hit that bell for great notifications. We did a podcast earlier in the week on diarrhea. I'm going to do a quick little summary review on diarrhea from a functional medicine root cause perspective. So what is diarrhea? You're going to have excessive water, hydration going into the intestines, typically the small intestine, colon. Why? What is the reason why? What's the body trying to do? There's something irritating, something very inflammatory that's happening in the intestines. The body's pulling liquid in to dilute it, right? Think of it as you make a mess, you're trying to get some water, you're trying to dilute it to kind of to kind of let it release itself, so to speak. So same thing, the body pulls a whole bunch of fluid in there to kind of flush whatever food allergens, food poisoning, parasites, etc., chemicals in the food, so to flush it out. So that's the first thing. So we have to look at it as, is it a chronic issue from food? Second, is it a chronic issue from food and now inflammation and irritation in the mucosa? Is it an acute issue like food poisoning, E. coli, salmonella, campylobacter? Is it an acute issue from a parasite but now has gone chronic, meaning, hey, you had that bad meal in Mexico, but now weeks later, you're still not feeling quite right. So we have to figure out what category is your diarrhea in. Is it acute? If it's acute, is it acute food or is it acute infection? Two, if that infection or that acute episode lasts, what's going on? Is there another infection going deeper? And then number three, if it's chronic, is it like an ulcerative colitis or Crohn's or some kind of irritable bowel disease? Is there some kind of chronic inflammation from food, from infection, from a combination of different things, SIBO, that are driving it? Like hydrogen-dominant SIBO is notorious with causing diarrhea. So you have to know kind of what pattern you have, chronic, acute, or an acute episode that has caused now a chronic issue. Really important to know that. Now, when we address that, of course, the first thing we're going to deal with is the food, getting the inflammatory foods out. A paleo template's a good starting point, or even moving towards a specific carbohydrate, kind of gaps, autoimmune, cooking things down can help. We may add in hydrochloric acid or enzymes to worry about, to break down the food better. If the food's very fibrous, it could irritate the intestinal tract. And number three, we may add in some healing, soothing nutrients. Bone broth is great. Ginger tea is great. Aloe, slippery elm, L-glutamine, all really good healing, soothing nutrients. I have one product called GI Restore that has a lot of those in it. I like that, but you can do a combination of mix and match and can be very helpful. Now, you may want to do some different lab testing if this has been going on for a bit. We may want to see if there's an infection, H. pylori, maybe SIBO, bacterial overgrowth, some kind of a parasitic infection, fungal overgrowth, worm. But it'd be good to know that. If it's chronic, it's also nice to see where your immune markers are. Is IgA through the roof? Is there a lot of calprotectin or inflammation in the intestines? It's nice to know that. Are we having a lot of steatocrit, a lot of maldigestion of fat? It's nice to know that too. We may want to work on adding in, like we mentioned earlier, hydrochloric acid, enzymes, maybe even some bile salts or extra lipase, so we can break down that fat better as well. If our stools are floating, we know, right, oil and water separate, so the more undigested fat in your stool, you're going to see the stool start to float. So that's also really, really, really important. And then outside of getting diagnostic testing done to figure out if it's more chronic, we can definitely address it. Also, activated charcoal is really good at slowing down the intestinal tract. It can also soak up and bind to a lot of toxic debris. Very, very, very helpful. Aloe, DGL, slippery elm, really other calming, soothing nutrients for the intestinal tract. Cutting out FODMAPs. Especially if you have hydrogen-dominant SIBO, the fermentable carbohydrates can be a driving factor of bacterial overgrowth, which can drive excess hydrogen gases, which can affect motility on the faster side. So cutting down FODMAPs, fermentable carbohydrates, going to the lower ones. I've done a podcast and videos on this topic. I think there's a handout as well in the members area on it. You can Google it on my site, and you can see it there, justinhealth.com. All right, any questions, let me know. And again, I'm very pragmatic when it comes to this stuff, meaning there's a whole bunch of research and stuff on it, but clinically, what's relevant? What works in the trenches? A lot of things that are totally theoretical, but then what actually works? So in general, when it comes to diarrhea or like IBS, IBS-D, right? There's IBS-D, IBS-C. When you're either constipated or you're on the diarrhea side, a lot of people are just labeled with chronic diarrhea. If there's no major inflammation, like no major intestinal inflammation, blood, serious gastric inflammation, they're going to be labeled with IBS-D. That just means they've ruled out all other inflammatory bowel disorders, tumors, cancer, ulcerative colitis, Crohn's, these kind of things. They're like, hey, we don't know what it is, but we're going to give you this diagnosis of exclusion, meaning we've ruled everything else out. Therefore, we're going to throw this at you, and then maybe you can do some Imodium or some kind of something that affects bowel motility. So you're kind of stuck in that camp, and then you're moving away from root cause to management. Who the heck wants to manage their diarrhea forever? We want to fix it and get to the root cause, figure out what the triggers are. I'll go to a couple of questions here off the bat, see if I can find people that are more relevant to the answers here. Grace writes in, hey, Grace, hope you're doing well. How do you support nausea in pregnancy? Also, a woman who is having intense food aversions. So first thing is, it just depends. So first thing is supporting fat digestion is very important during pregnancy. So if you're having a hard time with protein and fat, start off with some digestive support, some enzymes, some hydrochloric acid, maybe some bile support if we're having a hard time. Ginger tea is wonderful. Ginger tea is great to sip. Typically, the healthier you are going into pregnancy, the less nausea you will have. That's been my experience. So making sure someone's diet's good. I've seen a lot of women, they kind of use pregnancy as an excuse to eat like crap. Pregnancy, when you know you're pregnant, it's like you're training for a prize fight. That prize fight's 9 months from now, right? But you have to have that kind of mindset. It isn't a free-for-all where I can eat a whole bunch of crappy food. I have to really focus on nutrient density, keeping inflammation down. You have to have that mindset. The healthier you are going into pregnancy and going through pregnancy, the less of an issue you have with nausea. Ginger's wonderful. Digestive support's wonderful. Cooking up your food better, soups, those kind of things are great. Gabe writes in, is it normal to crave water throughout the day? I start my morning drinks with ginger tea. I drink a smoothie every other day and never drink anything after that. Do I get my daily dose hydration? Well, it depends. It sounds like you're getting a lot of water there. Ginger tea, that's not a diuretic. If you're getting a smoothie, that's really good. If you're doing any soups at all, that's really good. I would just say keep an eye on your urine. Make sure it's a light yellowish tinge. Probably about half your body weight in ounces is pretty good. But look at your urine. As long as it's not excessively yellow, you're probably okay. I always say it's good to wake up, start your day with a good glass or two of water. I'll do a cold shower, and then I'll kind of drink the water as it's hitting me for like 10, 20 seconds. I got a water filter, so it keeps it relatively clean. So I try to do 20 or 30 ounces to start the day, 20 to 30 somewhere midday, 20 to 30 to end day. So around 100 ounces or so. So I think it's a pretty good way to look at it. Javier writes in, what supplements to take for better digestion? I mean, HCl, enzymes, bile salts, those are some really good starting points. Can lemon water be as good as HCl pills for stimulating hydrochloric acid? No, but it's a really good first step. It's a really good first step to kind of ease your way into it. And if you see improvement with it, that's a really good kind of next step. You only can do so much lemon water, right? Anything more than a tablespoon, it's just too much. If I do 3 or 4 capsules of HCl and get 3 to 4 grams of hydrochloric acid, that's pretty potent. It's hard to combat that with just lemon juice. Great question, though. Ann writes in, I had testing done because of digestive bowel distress. All came back good, except I scored very, very low on amylase, almost non-existent. What do I do about this? Should I be concerned? Amylase is one. That's more of a saliva enzyme, though. The key enzyme for digestion is elastase. That's the one that's typically run. So you'd want to look a little bit deeper at that. But it would just depend. I wouldn't look at any marker in isolation outside of, you got to look at the whole patient and then look at the marker. So just that marker by itself, it doesn't raise a red flag for you. Gabriel said, I'm starting to develop a small cyst internally on the tip of my fingers. I was told it was due to me eating too many healthy fats. Best way to get rid of an internal cyst, a cyst on your finger. I'm not sure about that. I mean, you could pop it, see if it drains easily. If it doesn't, you can always do like a little poultice, get like a little cotton ball, soak it up with apple cider vinegar, put it on the cyst, and then you can wrap it up. That's helpful. There are some tea tree oil things that you can do on pimple cyst, and you could put it on your actual finger. And there's it's a couple of really good like tea tree oil acne kind of like salve, and you can put it over like a cyst or any inflammation, and it acts like a poultice to pull things out. That's a really good, helpful kind of first thing there. What causes nausea, vomiting? Any simple first things to do to troubleshoot it? Well, nausea in pregnancy is going to be exacerbated by the really high levels of HCG. So that's a little bit different. Typically, nausea, inflammation in the gut is going to be a big driving factor. So the more you pre-digest the food, keep the inflammation down, it's going to help. There's some natural nausea things like ginger, which work phenomenal. James writes in, Dr. J, I have issues with my mouth and sinus mucosa, very gelatinous, thick, but clear all the time. So some level of inflammations, the first thing I would do is do a good nasal flush. Make sure you're doing like a nasaline with the Neti X-Clear packets with the xylitol. On the website, justinhealth.com/shop, go to the recommended products. So there'll be an Amazon link there. I have the products that I use, but those are phenomenal to clean things out. You can also do a couple of drops of iodine or silver in case there's any other infectious debris up there. Probably something in the sinuses. Grace again writes that if someone's having intense food aversions, do you recommend mixing supplements? Which supplements do you recommend for all pregnant women aside for digestive support? So if someone's having food aversions, I always address things in phases, right? So the first phase is get the food right. And by getting the food right, that also means getting the cooking right and getting the macros right. So if someone can't tolerate much protein or fat, we figure out what the largest amount they can handle is without causing a problem. We focus on pre-digesting more. This is where getting an Instapot or a crock pot's great. And then tapering up there and doing enzymes and acids and really chewing our food well and making sure we have good parasympathetic nervous system response during that. And then from there, we go up the list. So it just really depends. You have to start at step 1 because we're not worried about going to step 4 or 5 if we can't step on step 1 or 2, right? It's not worth going there. So you have to work on the foundation and then go from up. Is it true that all people with autism have ADHD? I heard that from a chiropractic neurologist. All autism is, it's a bunch of symptoms in the I think it's the DSM-5 maybe, but it's a bunch of symptoms in regards to social, affect, interaction. There's a whole bunch of constellation of symptoms, and obviously there's a big spectrum of that. Now, clinically, what drives autism clinically is some level of brain inflammation. And of course, different areas of the brain being inflamed and to different degrees are going to cause those behavioral symptoms and social symptoms to be at different levels, right? The more inflammation, the more genetically predispositioned. Boys have a higher risk factor, right? Exposure to different toxins, a whole bunch of other things. I won't say the V word because I may get censored. And so in general, lots of different things that could be a driving factor there. So you have to understand what they're looking at, right? Big spectrum of symptoms, and you have to look at inflammation at certain levels will manifest those symptoms. So it's, of course, ADHD, ADD. It's possible that could be on that spectrum with more inflammation. So work on food, work on stress, work on water, work on environment, work on toxin exposure. That's the best first thing to do. See here, I got to jump. I got dinner here in a minute here. I got to head upstairs. Dr. caught C. diff after my loop ileostomy reversal. So it sounds like there was a colostomy bag. Could be wrong. 2010. Can this leave long-term effects on the colon, such as scarring, sensitivity, gut biome imbalance? Possibly. So if there's scarring in there, there's a massage group called Clear Passage that works on breaking that down manually. Also, I'll do systemic enzymes by VitalZyme and take that away from food to kind of help clear up the enzymes. I've had Crohn's and ulcerative colitis patients where we've seen nearly full reversal of their scar tissue and their fistulas and such with just making all these changes that I'm talking about here now. So I've seen amazing results. Those are a couple of strategies. Best protocol for SIBO, that's a loaded question. Done podcast on this topic. Go see the SIBO podcast. Again, at my site, justinhealth.com, everything is search engine optimized. Dr. J, how about intolerance to car fumes, cigarette smoke, pollution? Any recommendations? Yeah, that's just, it just depends. You can get your detoxification pathways healthier and better. All those things are really good. Getting glutathione upregulated. It's good. Being sensitive isn't necessarily a bad thing. We just want to make sure it's not making us, we're losing the ability to function, right? Obviously, good air filter for your home, good detoxification support. Evan's really, really sensitive to things. Evan's healthy, but I think his mold made his body, they call it tilt, tolerance-induced loss of immunity or toxin-induced loss of tolerance. So these little small things can throw you off. So we work on detoxification and getting those stress buckets out of our bucket there. Grace, you're welcome. I lost my sense of smell and taste dealing with a thyroid issue right now. It's not autoimmune, thankfully. What will help them get back? I don't even know where your thyroid's at testing-wise. If you're losing smell and taste, it probably is autoimmune because that's neurological. So if you're losing smell and taste, it probably is autoimmune. I would need a lot more information. Rashawn writes in, nausea from motion sickness, disorientation. Is that also gut inflammation? Anti-emetic drugs seem to help with that. Anti-emetic drugs. I need to know what the mechanism on those drugs are. So it just depends. Is it a chronic issue? Like every day you're driving, you kind of get disoriented. What's the frequency? What's the intensity? Has it gotten better or worse over time? That information is really important to know. And then from there, if it's something that just happened recently, then that's different. Donna writes in, your thoughts on sweeteners like birch tree, xylitol, or monk fruit. It's okay. Xylitol is a FODMAP. It can create gut distress, diarrhea, like talked about in this video. Monk fruit, I do like, all in moderation. Best protocol for SIBO. See justinhealth.com. Watch the SIBO podcast. Is it true too much daily sinus rinse can cause more harm? Rebound issue was told only use when congestion happens. Yeah, I think that's pretty good. You could still flush it out if you have allergenic issues. Just make sure it's pH balanced. Like you're using a sinus rinse like Neomed or Neti Xlear that has the minerals in there so it won't mess up the mucosa. That's key. How long does it take my body to eliminate toxic antibiotic side effects? I mean, that depends. It can be long-term, it can be acute, but of course things like ginger and activated charcoal are very, very helpful with that. All right, y'all, gotta roll. I'll try to be back on tomorrow, definitely Friday. You guys have a phenomenal night. Give me a like, thumbs up, share it with friends and family. Really appreciate it. Take care, y'all. Bye.